Hi, I'm Dr. Emily Bates. I'm a mother, I'm a person of faith, and I'm a scientist with a PhD from Harvard Medical School. I've taught cell and molecular biology to people who are now doctors. I've also taught scripture and learned from it myself. I'm going to talk about the COVID-19 vaccines from the perspective of a scientist with faith in God. This pandemic has been really hard. People have suffered the loss of loved ones, income, health, and gathering with the people that we love. We want this pandemic to be over. We, as people of faith, have prayed for the end of this pandemic. We've asked for a miracle to end the human suffering caused by this virus. I believe that God can inspire doctors and scientists to bring about miraculous healing. I believe that these vaccines can bring about the end of this pandemic, but victory over the pandemic, over the coronavirus, requires our participation. We learn about miracles requiring our participation in the Bible in 2 Kings chapter 5. I'm going to share my screen so that you can see my presentation. Naaman was a man who was afflicted with leprosy. A maidservant came to him and told him that Elisha could help heal him. So he rushed to Elisha and asked for a miracle. Elisha told Naaman to go down to the river Jordan and wash 7 times. This made Naaman angry. He didn't want to go wash in that dirty river. A servant told him that he really should trust the prophet and try to be part of this miracle. Naaman went down to the river Jordan and washed 7 times and was healed. The miracle required his participation. Coming back to the miracle that we are asking for, the end of this pandemic, as a person of faith, I see the record speed that these vaccines were developed and produced as miraculous. Scientists and doctors were inspired to work together. They were inspired with ideas. This is miraculous to me. As a scientist, I can see that if everyone takes these vaccines, our suffering from the pandemic will be over. But many have concerns about taking these vaccines. Like Naaman, we look at the river and we say, why? How? It's normal to find the science surrounding new vaccines confusing. This is where I feel inspired to help. I'll explain how the virus does its damage, how the vaccine works, and how we can show our love for our neighbors in this difficult time by taking these vaccines. It's easiest to think about how a virus works, like the coronavirus, by thinking of it as an invading army, invading humanity, invading our bodies. Its goal is to take over our body, to make more virus, to become stronger. Our immune system is our defensive army. Its goal is to detect and destroy the virus. A virus can't make more of itself alone. A virus can only make more of itself when it infects us. It hijacks our bodies to produce itself. In our bodies, a virus can mutate to become stronger, more infectious, or deadlier. These are those new variants that we hear about in the news. They were made in someone who was infected and had no idea they were making a new variant that was dangerous. Different viruses have different coats or uniforms. Here, the coronavirus is compared to the polio virus and the influenza virus. They have a coat that is unique. If our immune system hasn't seen a coat before, it has no defense against it. Coronavirus can shut down whole organs if it isn't stopped. In the lungs, it can infect it so many cells that the lungs don't work properly and can't clear fluid or breathe. A coronavirus infection can produce blood clots. It can damage the heart, the liver, and the kidneys to cause failure and eventually death. Those blood clots can also damage the brain by causing strokes or mini strokes. As of today, over 500,000 people in the United States have died of COVID-19. And over 2.5 million people have died of COVID-19 worldwide. Our immune system fights back when it detects an infection. The symptoms we feel, like a fever or soreness, are our immune system fighting the virus. But the real damage is the virus is what the virus does to our organs that can eventually kill us. So what helps the coronavirus in this fight? Having a coat that isn't recognized. For most of us, we've never experienced this kind of infection. We don't know this coronavirus coat. A lot of virus coming in at once can also give the virus an advantage over us. Or having a weaker immune system that can't mount or build a big army against that virus. Right now, we are outnumbered. There are many, many more viruses in the world than there are people. And our immune systems have never seen this virus before, for most of us, if we haven't been infected by coronavirus. So what would help our immune system? A vaccine is a warning sign to your immune system to kill the virus before it takes over your cells. The first vaccines that were ever generated for any kind of virus were a dead or injured virus. And that would be less deadly, less harmful than the real virus. And so for polio, for example, something that looked like the original virus but wasn't infectious could be introduced and save millions of people by warning of the immune system what that looked like. Later, something like a tiny piece of the uniform was a vaccine. That would tell someone that anyone wearing that particular hat was dangerous and needed to be destroyed before it destroyed us. And those vaccines worked. For example, for polio, which was a disease, a viral disease that caused crippling and death of a lot of people, when the vaccine was developed, that's this orange circle here, enough people were scared of polio that they took that vaccine, and enough people took the vaccine to completely eradicate polio. So we no longer have to be scared of polio in the United States. The same was true for many of these other diseases, like measles that causes a rash or can cause the swelling of the brain for 1 in 1,000 children who was infected with the measles. But once that vaccine was generated, there were many less infections, and that threat became much less. But you will notice that it took years to develop those vaccines. In addition, the virus or the coat decoration had to be grown in cells and was often made in chicken eggs. So if you were allergic to chicken eggs, you couldn't take the vaccine. And those allergic reactions scare people. And so scientists have been working to develop something that would generate many fewer allergic reactions. And mRNA was an idea that started to be tested even in the 1990s, 30 years ago. M stands for messenger. RNA is a degradable pattern or instructions for making part of the army uniform of a virus. So our cells would produce part of that coat as a warning sign. It's not dangerous, it's just like a button on a coat or a hat of a uniform. mRNA vaccines can be developed fast just by reading the instructions of the virus itself. mRNA can also be made fast once it's been developed. In my lab, it would take an hour to make mRNA, whereas to make a part of that army uniform, a decoration on the coat, would take several days. mRNA can also be adapted fast as these new variants arise. We can read the instructions of the new variant and then make a vaccine against that, or develop a vaccine against that. There's also less potential for allergic reactions because it's not made in cells. There are less ingredients. So is this mRNA technology new? No. Scientists have been working on developing mRNA vaccines since the 1990s, and mRNA vaccines against cancer, the flu, HIV, Zika, and rabies started clinical trials before 2017, and those have been published. But it takes longer to finish clinical trials if people aren't scared of a disease. And so, or if there are less infections. There's not a pandemic going on for any of these diseases right now. And so those clinical trials take longer to complete. So what's in an mRNA vaccine? It's a tiny lipid or fat droplet exterior. Lipids or fats are something like olive oil. They can have different properties, and when they're chemically described, they have fancy names that you can read on the ingredients, but they're just fats. Then that lipid fat droplet protects the mRNA, which is the pattern to make part of that enemy uniform. It's not dangerous on its own, and neither is that part of the uniform. It's just a warning sign of what the virus looks like. Then there's salt water and sugar. Our immune response to this is amazing. Once it sees this tiny threat, it produces antibodies to neutralize the virus. The antibodies cover the virus so that it cannot infect cells. The virus cannot replicate. The virus cannot turn your cells against you. It just bounces right off, and so that your cells are protected from a virus infection. Antibodies also present the virus to cells and enzymes to teach other immune cells to destroy or eat the virus. I'm a child of the 80s, so I drew these types of cells as a Pac-Man. A vaccine will also teach immune cells, our immune cells, to kill cells that are infected by the virus. This is important because we don't want those cells that are traitors, that are working for the enemy, to continue to produce virus that can infect us and overwhelm our immune system. So a vaccine will teach our immune cells to kill infected cells. So how are vaccines different from other medications like Tylenol or ibuprofen? These types of medications distribute throughout our body. They stay in our system for several hours, and they treat the symptoms. Like they'll bring a fever down and make you feel better, but they're not destroying the virus at all. The virus is continuing to destroy our cells and replicate in our body, even though we feel better. Vaccines, on the other hand, use your immune system to cure and prevent the virus from infecting you. Your immune system is the actual medication. It is warned and it destroys the virus. It's broken down within 2 hours after the injection. These mRNA vaccines are restricted to the injection site, so they're not going to be traveling through your body. They couldn't even go into a baby that's developing in a pregnant person. So really, a vaccine is the most natural medication that there is. It's really your immune system that's doing the work. How do we know if we can trust a new vaccine? Well, these clinical trials were done in over 30,000 people, and people would receive either the vaccine or a shot that didn't have any vaccine in it. They wouldn't know which one. Then they would report any symptoms that they felt, any side effects, and the data was collected in over 100 hospitals by doctors and nurses who had no vested interest in the outcome of the clinical trials. Then that data was reviewed by a safety monitoring board, independent scientists, career scientists at the Food and Drug Administration, a committee on immunization practices, and the Center for Disease Control. None of these agencies or reviewing boards had any vested interest in the outcome. They don't get any money if it either is good or bad. They just want to protect us and help us to get safe and effective vaccines. The Pfizer and Moderna vaccines protect 95% of people from even mild COVID-19 symptoms and protect everyone from severe COVID-19 or COVID-19 related death. The Johnson & Johnson vaccines were tested in a different scenario. There were new variants that were around, and so this vaccine is likely just as effective. It protects everyone from severe COVID-19 and COVID-19 related death, and it protects over 70% of people from even mild symptoms of COVID-19. The side effects from getting any vaccine can include soreness, fatigue, or mild fever. And these just show us that our immune system is building a defense against the virus. It takes a lot of energy to build an army against a virus. So it's normal to feel tired or sore as the immune cells rush to the site of vaccination. I myself have had one of the vaccines, and I got a sore arm, and that was it. I didn't feel any other symptoms. So a vaccine gives us a choice. It gives us the choice to decide which side are we on. Without the vaccine, the virus can use you. It can use your body to hurt yourself and the people that you love. But when you take the vaccine, you destroy coronavirus. You make weapons inside your body that kill coronavirus. And that can save yourself, and it can also save the people you love around you. I hope that you will choose to join the side of humanity and protect both yourself and the people that you love and the people that I love by getting the vaccine. There are a lot of rumors going around the internet, so it's important to look for valid peer-reviewed science articles so that we can know that the information that we're getting is true. These are some of the sources that I used. I look at the Center for Disease Control and the World Health Organization. I've also looked at many different articles that are published in peer-reviewed science journals. You can search a search engine, use the search engine called PubMed, and this will be only peer-reviewed science articles, and it's a great source of information. I have other videos that talk about some concerns that I've heard and I address those concerns, such as whether to take the vaccine if you're pregnant, if it affects your fertility, it doesn't, and other concerns that I've heard. So you can check out my other videos if you'd like. Thanks for listening, and have a good day.